Now, if you're someone that is currently dealing with pain along the inside of the shin caused by shin splints, then stay tuned because in today's video, we're going to go over the best exercises that you can use to help get rid of this pain. Welcome back, guys. My name is Dr. Mike, and I'm a physical therapist providing tips on how to build strength and longevity with your body. Now, as a physical therapist, one of the common conditions that often comes up when someone is increasing their activity level, specifically with running or even jumping or even as simple as walking, is shin splints. This is simply when they are starting to have a sharp pain along the front side of the shin there. And many people want to know, well, what should I be doing to help these shin splints go away? And other than being particular about the shoe wear that you're wearing or even modifying or reducing the frequency of that specific activity, there are some strategies that you can use to help get yourself out of pain and help ensure that you're training those muscles the proper way to be able to accept that new activity that you're participating in. One of the first ways that we can get started with reducing your pain along the front of the shin is working on soft tissue. I am a firm believer that we have to address massage and soft tissue, myofascial release, whatever we want to call it. We have to address the tissue along the area that's causing us the most pain. If I'm having pain along the top of the shin on my right leg here, one of the most effective ways that I can treat that area is simply coming in here and putting my fingers along the tissue. Now we have that tibia bone that runs down the center of my lower leg, but if you just take your fingers and you start to kind of rub along that area, you're going to feel some of that soft tissue, the muscles that surround that tibia bone. You're going to start to feel that some of the area might be more sensitive than the other. Now, you don't have to be a massage therapist in order to really get in and do some great work for yourself. But the point I'm trying to make here is if you spend about 2 to 3 minutes of going in there and really working on the soft tissue, you can really provide yourself with a lot of relief. You'll often find that this area feels very sticky and tight and it doesn't move. Tissue is supposed to move in many different directions. So if you just take your fingers and you go downward and you go upward and you go in different angles, you should be able to find that the skin moves freely. This motion where you're kind of moving your leg side to side is an easy way that you can start to release a lot of that fascia and a lot of that connective tissue. And just spending a few minutes on each leg, if you're having pain on each leg, can be a very effective method to start with so that you can start getting out of pain. Now, after we've spent an adequate enough time working on the soft tissue on the lower leg, then we can start getting into some strengthening exercises that you can use to help develop strength and coordination in that area. So the first exercise that we're going to get into is called a tibialis raise. This specific exercise is targeting strengthening the muscles of the front of the shin. And what you're going to do is you're simply going to be leaning on a wall like the way I'm doing here. I'm on a rig here. And all you're going to do, keeping your feet together, is you're going to lift the forefoot, your toes and the front of your foot off the ground. So I'm essentially shifting my weight to my heels, lifting those toes as high as I can go. When you perform this, if you do about 15 to 20 repetitions, you're gonna feel a big burn on the front of the shins. Those are the muscles that we're gonna be retraining for this particular exercise. Now, the closer your feet are to the wall that you're standing on, the easier this will be. So if you wanna make this more challenging, you would essentially move your feet away and start to work on going against that gravity and really trying to lift your toes up as high as you can. Now, one trick here that many people forget is that we have to focus on working the muscle eccentrically. What does that mean? We have to show control in that muscle because if we work the muscle eccentrically, that's going to allow us to be able to accept high impact and a lot of load through those muscles of the lower leg. So what that means is when you perform this, you're gonna raise both toes up and on the way down, you're gonna slowly control it on the way down. Once again, you're gonna lift up. You can go even fast there, but you're gonna slowly control it down. When I raise it up, I am training those muscles concentrically, but when I slowly release it, I am getting a nice stretch of those muscles and training them eccentrically. This is gonna be one of the most effective exercises that you can use a couple times a week to help really start to get out of pain. All right, so the next exercise we're gonna get into is now gonna be focusing on the muscle group in the back of the lower leg. This is specifically training our calf muscles. Now, once again, we're gonna take the same approach and really focus on eccentrically strengthening these muscles. So what you're going to do is you're going to basically take your foot, and I say foot because you're gonna do single leg at a time, and you're basically gonna allow the heel to come off a box or a step or something that you have access to, and the foot's gonna essentially be facing forward like this. The opposite leg, I have some people go behind them to get out of the way, or you can even go in front. But essentially what you're trying to do is keep that knee straight, and you're trying to let the heel drop to the ground. When I let my heel drop off a box or a step, I'm already getting a good stretch in the calf and in the Achilles area. But now what I'm going to do is holding on for support, because this is not a balance exercise. This is a strengthening exercise. You're gonna go up as high as you can on your tiptoes, really trying to think about pushing through that first big toe to get a good contraction of the calf, and then you're gonna lower down nice and slowly. Just like with the last exercise, if you perform about 10 to 12 repetitions at a time, that can be very effective. And the reason why I have you do one leg at a time, because we often find that there are asymmetries in the lower body. And if you simply just do two legs at the same time, sometimes that really is not challenging enough for people. So really isolate each leg by doing one leg at a time. All right, so we're gonna move on to the last exercise, which I think not only can be important for just getting out of pain quickly, but also for keeping this pain away for good, is ensuring that we are strengthening our hips. The single leg Romanian deadlift is one of my favorite ways that we can strengthen our hips so that we can really focus on ensuring that this pain does not come back once again. Now, I prefer to perform this exercise using a dumbbell because it allows me to get a greater range of motion of the hip. And what I'm simply going to do is I'm going to basically stagger one foot in front of the other, just like so. And I'm gonna take the dumbbell and place it in the opposite hand. When I place it in the opposite hand, it allows me to keep good balance during this exercise. Now, all I'm going to do is I'm going to allow the back leg to kind of hover over the ground. In that front leg, I'm gonna have a slight bend in the knee, and I'm gonna come down forward, keeping the weight as close as possible. As I'm doing this, I'm feeling a deep stretch as I lower the dumbbell all the way through my hips, all the way through my glutes and my hamstrings. And I'm trying my best to keep my pelvis nice and leveled and not rotate. I'm really just trying to get good hinging motion out of the hip. That means I'm getting the bend from the hip and not my lower back. I don't want to be doing this sort of action here. We really want to keep a nice tall chest and work on hinging at the hip, allowing the dumbbell to come back down. When you're working both sides, you're going to realize one side is harder than the other, but that is going to truly help you address the bigger issue. And really, this is going to be a phenomenal exercise to add in conjunction with the other stuff that we've taught you earlier in the video. Guys, if you found this video helpful and maybe you're already working on some of these exercises, let me know below which exercises you're currently working on, or maybe there's other exercises that have been effective for you to treat this condition. In the meantime, if you want to support this channel, please do me a favor and give this video a like and a thumbs up and subscribe below.